Welcome back. Now, here's something maybe you didn't know about me, but I actually wear contacts. I have horrible eyesight. So I'm actually coming out to Southwestern Eye Center kind of for a little bit of a selfish reason, because Dr. Diaz, I have talked to many people who have had LASIK surgery done, and they rave about it. So I had to come out here and learn a little bit for myself. So what is LASIK surgery? Because of course, I'm going to ask you if I'm a candidate.
Okay. Well, thank you for coming. So LASIK surgery is one of many refractive surgeries that are intended to decrease the dependence or eliminate the need for glasses and contacts in patients that are affected by their glasses or contacts for various lifestyle reasons.
And so who's the right person for this? Because I'm listening.
Yes. So we have, of course, a lot of patients that come in or call wanting to know if they are a candidate. They want to get rid of their glasses or their contacts are bothering them, or they are having problems because of work or hobbies. So there are many different things that we need to look at. Of course, we talk to the patient to see what their outcomes and expectations are, to make sure they're realistic. We do the full eye exam as we do for other eye conditions. We dilate the eye. We measure the prescription. So by knowing the prescription, then we know the type of treatment and the amount of treatment. And then we do measurements on the cornea to make sure the cornea is healthy and that it's thick enough for the treatment we intend to do.
And I'm sure probably the second question people ask after finding out if they're a candidate is it safe?
It is very safe. So refractive surgery has evolved over the last 15 to 20 years. And at this point, we do refractive surgery at Southwestern Eye Center with all lasers. In the past, blades were used to cut on the cornea, and then the laser was used to resurface the cornea. And the newer lasers are much safer. We've eliminated the blade to cut the cornea. Plus, as all technology has evolved, the outcomes have become much more precise. And in a lot of cases, patients see better after LASIK than they ever did with their glasses or contacts.
Wow. And so we're talking about the advancements, of course, and where we're at. So are there any risks that you would have to tell a patient going into this?
Sure. As in any other surgery, we discuss all the risks that are involved beforehand. The risks are very rare, but with LASIK, as with any other surgery, the main risk is infection. And so we give patients antibiotics to prevent that. There's also a risk of inflammation. We give medications to prevent that also. Some patients rarely have too much or too little correction, and we have to do a small touch-up at 2 to 3 months out. But by and large, losing vision, decreased vision after LASIK surgery is extremely rare nowadays.
Okay, and I know throughout our life, from when we're a child, I've been wearing glasses since the 3rd grade, and then going in to our later years, our eye changes, even our own prescriptions change. So does this ever wear off?
So LASIK treatment does not wear off. Once we do the treatment, we reshape the cornea, and that's a permanent change. So the changes that patients may experience are similar to what they experience as they change the strength of their contacts and glasses over years. So if, for example, what age did you start using glasses?
3rd grade.
3rd grade. So 3rd, 4th grade, you may have been a 1 diopter -1, let's say, if you're nearsighted. And then over the years, you went up to 2 or 2.5 to 3, 3.5. Every year or two, you would go back, you notice your vision was getting blurred, and it would go up a little bit. At some point, the eye stops growing, the eye stops changing, and that prescription levels off. And that's one of the things we look at is, if you come in for an eye exam to see if you're a candidate, we see the stability or how your prescription's been doing over the last few years. If your current contacts are a -6, and last year they were -5, then that means you've been changing, especially over the last year. And next year they may be a -6.5 or -7, and so on. So once we do treatment, if the eye continues to change, then your prescription will change in the future. You'll no longer be a 6, but you still may need glasses down the road if you're not stable. But if somebody's had the same prescription for the last 2 or 3 years, then they're a good candidate, because that means that they shouldn't progress in the future.
And that's, I think, what I've heard also in the past, that once you kind of go over a certain amount of time and your prescription hasn't changed, that it gives you a better opportunity to become a candidate for LASIK. See, I told you I've been looking into this. So your best advice is, if you're looking into this and you think this would benefit your life, is the first thing is just to come in and get a consultation.
Yes, the consultation is a free consultation, and we do the exams that we were discussing, thorough exam, and we go over the patient's expectations, and we can tell if you're a candidate or not within a short period of time. It's very simple. It's a simple discussion, and then it gives you the tools to make a decision.
Yeah, and like you said, a lot of people walk out with better vision than they had with the glasses or the contacts. Doctor,
Yes.
This has been very enlightening. Like I said, I wanted this information a little bit for myself, because I think this is something that could definitely benefit someone's life. So again, thank you so much.
Thank you very much.
And for more information about LASIK and eye health, you can call Southwestern Eye Center at 790-8888.